What is dialectical behavior therapy? If you have a child with psychiatric or behavior problems, there's a good chance you've heard of mindfulness and cognitive behavior therapy, two different approaches to helping kids with everything from test anxiety to depression. But there's another very promising therapy that combines elements of both. DBT, or dialectical behavior therapy, is an intensive, highly structured program that's been adapted specifically for adolescents with extreme emotional instability, including self-harm and suicidal ideation. The dialectical in DBT means the therapy works by dealing with two things at once that might seem contradictory: acceptance of feelings, or mindfulness, and learning to use thinking to change feelings, CBT. DBT allows an individual to see the dialectical truth of, I'm doing the best I can, and I need to do better. That both truths coexist and create balance. Let's start with a brief history of DBT. Dialectical behavior therapy was developed by Marsha Linehan, PhD, in the 1970s to treat adult borderline personality disorder, a mental illness with symptoms ranging from chronic suicidal thoughts and/or self-harming behaviors to anxiety and depression. These patients were typically thought of as difficult, if not impossible, to treat. Dr. Linehan redefined the disorder, reframing it as a specific problem of the emotion regulation system that can be addressed with a structured intervention. People with borderline personality disorder have trouble regulating their moods, which leads to impulsivity and conflict in interpersonal relationships. That, in turn, often leaves them feeling misunderstood by others around them. First, Dr. Linehan tried traditional CBT, which emphasizes using conscious thoughts to confront and change problematic emotions. She was unsuccessful with her patients, so she then tried a more acceptance-based approach that came out of her own meditation and mindfulness practice. This too failed. She then had the idea to blend the acceptance strategies of mindfulness with the change techniques of CBT to create this dialectical approach. How does DBT work? DBT treatment is designed to help with extreme emotional instability, which clinicians call dysregulation, the inability to manage intense emotions. Dysregulation leads to impulsive, self-destructive, or self-harming behaviors. The goal of DBT is to teach adolescents techniques to help them understand their emotions without judgment, the mindfulness component, and also to give them skills and techniques to manage those emotions and change behaviors in ways that will make their lives better. But it takes work and commitment. DBT for adolescents involves individual therapy and group skills training where parents and teens learn together. Other components include telephone consultation. Patients are encouraged to call their therapist when they feel the urge to self-harm, family therapy, and weekly consultation team meetings where the therapists check in with other professionals to consult on the case. What skills does DBT teach? DBT skills training is very structured. For adolescents, it consists of 5 modules: mindfulness skills, being present in the moment and understanding the signs of unregulated emotions; emotion regulation skills, coping with difficult situations by building pleasant, self-soothing experiences to protect from emotional extremes. Especially with teenagers, there's a big focus on the physical body, eating properly, getting enough sleep, taking their medicine, and avoiding drug use. Interpersonal effectiveness skills. It's often interactions with others that are the negative triggers for impulsive behaviors. The purpose is to teach adolescents how to interact more effectively with others and enable them to feel more supported by others. Distress tolerance skills. It's being able to recognize urges to do things that would be ineffective, such as hurting themselves or trying to kill themselves, and consciously controlling those urges. Walking the middle path skills. Kids and parents learn how to validate one another, how to compromise and negotiate, and how to see the other person's side of things. This has to do with acknowledging multiple truths in the teenager's and the parent's worldview, as opposed to, I'm right and you're wrong. What does DBT use to treat in adolescence? Borderline personality disorder was historically considered something that could not be diagnosed in a person under the age of 18. But at the Child Mind Institute, we now feel that symptoms of the disorder do develop in some adolescents, and the debilitating roller coaster of extreme emotions that they experience can be effectively treated with DBT. DBT has also proved effective treating the emotional instability and severe behavioral symptoms, self-harm and suicidal thoughts or attempts, seen in adolescents with other diagnoses, including drug abuse, eating disorders, depression, bipolar disorder, disruptive behavior disorders, ADHD, and anxiety. Finally, DBT is a good treatment to be used to treat adolescents with coexisting conditions that often include suicidality or self-harming behaviors. Thanks for joining me for this video. I'm Dr. David Friedlander, a clinical psychologist at the Child Mind Institute. To learn more about depression and mood disorders, visit childmind.org/mood support. There, you'll find everything you need to know about our cutting-edge, tailored treatment services for children and adolescents suffering from mood disorders, plus hundreds of articles and guides to help you support children who are struggling with mental health, behavior, or learning challenges.